Welcome to Aster CMI Hospital, where the world comes for international healthcare solutions.
Stroke occurs due to the disturbance in the circulation to the brain. Just like a heart attack, we call the stroke as a brain attack. Mainly there are two types of the stroke. One is ischemic stroke, which occurs due to the blockage of the blood vessels supplying the brain, and other is hemorrhagic stroke, which occurs due to the rupture of the blood vessel within the brain. Time is brain in the management of the stroke. 1 million neurons die every minute during the stroke. So stroke has to be identified at the earliest and should be treated as early as possible in the golden hours, what we call as up to 6 hours from the onset of the symptoms. If the patient comes to a proper setup where there are the facilities for the brain imaging and where there are the facilities for the brain angiogram, we can identify the stroke and we can treat the stroke aggressively in the golden hours. So in the golden hours we do a brain angiogram to identify the exact site of the block in the blood vessels, and thereby we can do a latest technology in the Aster CMI hospital, what we call as a mechanical thrombectomy, where we will pass a small guide wires and microcatheter till the site of the clot, and we will remove the clot by using the stent retriever device, and thereby the blood circulation to the brain is established immediately. Immediately following the procedure, the patient will notice the improvement in their symptoms and the majority of their symptoms can be reverted back. Stroke is treatable, stroke is preventable. Like as already told, if the patient comes in the golden hours up to 6 hours from the onset of the stroke, we can do the latest advanced treatment called as a mechanical thrombectomy, in which we will do the brain angiogram, and then we will take the stent retriever device and we will remove the clot which is causing the obstruction in the brain. In the same way, stroke is preventable. The most common cause for the stroke is the deposition of the cholesterol in the neck vessels supplying the brain and causing the carotid stenosis. Carotid stenosis can be treated by carotid angioplasty and stenting, and thereby we can prevent the further future strokes. The most common cause for hemorrhagic stroke is rupture of the aneurysms. Previously, ruptured aneurysms was treated by doing a major open surgery, by doing the craniotomy, retracting the brain and clipping the aneurysms. Nowadays, it can be treated by brain angiogram, and through the endovascular modality, we will do the coiling of the aneurysms. Even the major complex aneurysms can be treated endovascularly by using the flow diverters. I would like to convey a strong message to the public that stroke is treatable, stroke is preventable. Once you identify the stroke symptoms, please immediately rush to a hospital where there is a facilities to do the brain imaging like CT scan or the MRI brain, and where there is a cath lab facilities to do the brain angiogram so that we can identify the site of the clot. In the golden hours, we can do the mechanical thrombectomy, and thereby the blood circulation will be restored immediately, and thereby the major morbidity we can be prevented and the majority of the symptoms can be reverted.